It's undeniable that servicing the insurance industry adds substantially to the cost of health care without contributing anything to health, and they are at the core of the problem. That said, let's move our focus from them to us.
One of the strange things about our healthcare system is probably in the neighborhood of 60 to 70% of people who have either a Medicaid program or a Medicare program or commercial insurance don't realize the cost of that health care that they demand. And they often demand everything to be done for them because there's no cost to them that they can directly see. There is a cost to them, but they don't directly see it. Especially in commercial insurance, they don't directly see it until they understand that these huge premiums they're paying are buying those services, whether they really need them or not. And it's not uncommon, unfortunately, to have people in those situations demand tests, demand medications, demand treatments that they don't really need, and in some ways probably aren't even good for them.
The sense of entitlement of getting anything that's possible and available because, quote, I don't have to pay for it anyway, is a major flaw in our thinking. Not only do we all pay for it anyway, it's driving the cost of health care to such an exorbitant level that none of us can afford basic health care anymore if we don't have insurance, which we're all paying for.
The other side of the coin of this is that 30% who have no access to health care, of those uninsured people going into the emergency room late in their disease process, costing a lot of money. That whole cost, again, is shifted back to that 60 or 70% of people who feel that they're getting their health care sort of free. They don't have to pay for it. But they see it in higher premiums, sometimes in higher taxes. But we're all in this together. And if we don't realize that, then we're going to continue to have a spiraling of our health care costs up and a spiraling of our outcomes down.
I've took care for about 20 years of a man who just died this week of lung cancer. He developed a cancer that was already too advanced to operate on. He got radiation, he got chemotherapy. He was a man in his mid-80s, probably 86, 87 actually. So he'd lived a long life and he'd been healthy most of that life. He developed a brain tumor. Cancer spread to his brain. And really before I knew it, his oncologist had consulted a neurosurgeon and he had that brain tumor removed surgically. After about 4 or 5 months in the hospital, in rehab, he managed to get home, spent about 2 or 3 months at home, and then died. I think that was just an extraordinary waste of resources and a persecution of this elderly man. We probably spent $500,000 to $1 million to get those 2 or 3 months, and most of them were spent in a hospital or rehab facility.
We have been under huge amount of pressure by patients' family who have not been able to accept the inevitability of the death of the individual. At the same time, the incentives are there for the healthcare system and providers, whether the providers are institutions or individuals, to provide this care because of the reimbursement system, which reimburses quite strongly for those intensive types of services. And our expectations have to be much more realistic. Most individuals, when they really sit down and talk and think about it, are really more interested in quality. They fear more than anything else the debilitating stroke, ending up in a nursing home, ending up with Alzheimer's disease, not knowing who they are or where they are, not relating in a human kind of way with their loved ones. And yet, decisions are made over and over and over that do not reflect that goal. And when we draw from the public pool or from the medical commons, as Howard Hyatt has referred to, I think we have to be especially judicious in the use of these precious resources and limited resources when we apply them to end-of-life treatments that may at best only prolong the dying process and often lead to not particularly good quality of life outcomes.